All right, guys, so in this video, I'm going to be covering the side effects that we can see from Indomethacin. Also goes by the brand name Indocin. So I'm going to hop right into it. So Indomethacin is an NSAID, non-steroidal anti-inflammatory drug. So is ibuprofen, very common class of medications. But it blocks COX-1 and COX-2 enzymes. And this is important because not all the NSAIDs do this. And while that sounds like a good thing, it introduces some side effects. So number one, you have to understand, for example, COX-1 enzymes are present in your stomach, they're present in your guts, your kidneys, your platelets. So they'll affect, when you block them in those locations, it's going to affect the stomach, it's going to affect bleeding. The COX-2 is present in the pain process, inflammation, the macrophages, which are part of your immune system. So we can see some of those things. I like to go over what a drug does in your body. It's going to help you understand some of the side effects that we see. So first of all, I'll just kind of go from top to bottom as far as most common. We can see upwards of 12 to 16% of people experience a headache when they take Indomethacin. And we have ranges on these because the higher the dose, the higher you're going to be on that percentage of side effects that can occur. Stomach-wise, we can see vomiting upwards of 12% of people. Post-operative hemorrhage, upwards of 11%. That's important. Make sure to let your doctor know if you're on Indomethacin and you're going to have a surgery. They definitely want to know that you're on that. Stomach pain, 3 to 9% of people. Nausea, again, 3 to 9%. And finally, heartburn, 3 to 9%. Can we see other side effects? We can. These tend to be our most common ones. Now, there's a couple of warnings that you need to know about. First of all, if you have any sort of allergy to the other NSAIDs, you do not want to take Indomethacin. Important to point out, if you tell me, hey, I took ibuprofen and it gave me a stomach ache, that's not an allergy, okay? An allergy would be, I took ibuprofen and I got a rash, it felt like my throat was swelling shut. That's a true allergy. Don't want to take Indomethacin if that's the case. Also important to note, a big warning is NSAIDs can increase the risk of serious cardiovascular side effects. This is all the NSAIDs, okay? What we mean by that, MI is heart attack. We can also see strokes. Are they common? No, but very important for you to know about those. Finally, GI, so we can see GI inflammation and bleeding, so stomach bleeding. All the NSAIDs are known to do this, and it's important that you're aware of this. So let me know in the comments, have you taken Indomethacin? Did you get any side effects? If so, what were they? It's helpful for me to get your feedback with the medication. It's helpful for other viewers to hear your feedback as well. So speaking of helpful, I hope the video was, guys, and I'll see you in the next one. Thank you.